you can start with.
Hi, I am Dr. Abhijit Pawar, a consultant spine and scoliosis surgeon at Kokilavan Dhirubhai Ambani Hospital, Mumbai.
So, as we all know, change is the only constant. Hence, we would like to understand, in your view, how has spine surgery evolved in the last 10 years and what have been the most significant advancements which have transformed the patient outcomes?
Yeah, spine surgery has evolved from standard open surgery to minimal invasive and endoscopic spine surgery, and hence the outcomes are getting better. There was a time when patients used to be scared of getting spine surgery because in standard open surgeries there was risk of bleeding, infection, neural injuries. So those chances have almost gone to zero with advances in robotics, navigation, neuromonitoring. The spine surgery has become safer, effective, and result oriented.
So, how do you see these emerging technologies like artificial intelligence, 3D printing, augmented reality impacting spine surgery at your practice in future? Will these remain as jargons or truly shape up the spine practice?
Yeah, nowadays patients want safety and accuracy, particularly in patients with high-end deformities or in advanced spinal problems. The patients are scared, even the doctors have a little bit of fear that the spine surgery might do some harm to the patients. So in those cases, particularly the AI, robotics, navigation, and different advances have led to accuracy and safety. So I think it's important and it's going to be a new way of life.
So, do you feel awareness on osteoporosis in our country is still at a nascent stage? How do you feel this issue can be addressed?
Osteoporosis?
Yes.
Yeah, osteoporosis is a silent epidemic going on in the country. And in my opinion, almost all women above 50 years of age are osteoporotic. And they try to ignore it to some extent. And one of the reasons is most of the women after 50, they don't exercise, they have lack of calcium and vitamin D supplements. Uh, and if they have any other medical issues like diabetes or any other comorbidities, they further, it leads to aggravation of osteoporosis. So I think it's a silent epidemic going on in India, particularly in women.
So, in your practice, how are you currently managing the patients with osteoporosis and osteoporotic fractures?
Yeah, in initial stages, only osteoporosis, all women we recommend calcium, vitamin D supplements, bisphosphonates, exercises. We do a DEXA scan to assess what is osteoporosis. If those patients they don't respond to these measures, then we switch to some anabolic agents like teriparatide, which has been a game changer nowadays in management of osteoporosis. So that is what we proceed. If the patient has osteoporotic fracture, we start them with all of this treatment like calcium, vitamin D supplements, investigate the cause of osteoporosis, and start them with anabolic treatment like teriparatide.
My last question would be, what would be your message to aspiring young surgeons who aspire to specialize in spine surgery? And what are the key skills do you believe would be essential for success in this field? How do you feel they can curtail the learning curve?
For the young surgeons, they should know that spine surgery is a tough learning curve. It takes about good 2 to 3 years of dedicated learning with a good team. You should have a good mentor and a fellowship where there are at least 4 to 5 spine surgeons who work in the same group. So you have access to maximum number of surgeries. You have access to multiple techniques because every surgeon has a different technique, and you learn from each of them and try to evolve and do a patient-centric approach where end of the day patient should do well. So learn from the masters, learn from multiple people, and evolve with your own experience and your own training.
Thank you, sir.
Thank
Thank you
you so
so
much.
much.